Hey guys, this is Dr. Wijay from Elite Dermatology and the Oaks Plastic Surgery. You're probably watching this video because you're about to have your first free telemedicine visit with me in regards to your weight loss semaglutide program. If you're watching this video and don't have an appointment with me, your first call is free. All you have to do is text the number on this screen or visit us at theoaksplasticsurgery.com or elitedermatology.com. But the texting of our number will go straight to our schedulers to set up your first free weight loss consult with me via telemedicine. So how does semaglutide actually work? Semaglutide is the generic name of Ozempic and Wegovy. Semaglutide basically replicates natural appetite hormones. And what that does is it reduces the appetite feeling in your brain to make you eat less, therefore reduce your calories over time. It also slows down gastric motility, and by doing so you feel full, so you eat less. So the combination of feeling less hungry and full faster, we're seeing a tremendous amount of weight loss over the next 6 months and especially over the next year. I'm sure you have friends or a family member or have heard of it online of how well it works for weight loss. And it is true, on the majority of patients, it does an incredible job of working on your weight loss. So the next part is talking about semaglutide risk factors. The main and most common risk is nausea and constipation. If you're nauseous, our coordinators can prescribe you Zofran to help you with your nausea, and for constipation, just do over the counter. Some contraindications for the medication, and if you have any of these, please let me know. We do not prescribe this medication for anyone who's pregnant or breastfeeding. Semaglutide has a very rare form in a rat model or a rodent model of MEN type of thyroid cancer. So if you have any family history of thyroid or nodules, cancerous nodules on your thyroid, please let me know. We wouldn't prescribe it in that case. That is different from someone who has hypo or hyperthyroidism. We're specifically talking about cancer. Patients who are currently on diabetic medication. Semaglutide originally was a type of diabetic medication. So if you're on diabetic medication and you add semaglutide, your sugars can drop too low, making it unsafe at that time. So if you are on diabetic medication, let me know, and we would have to come up with a plan to make sure your sugars are safe, and we will go through that on an individual basis. The other risk factors, if you have any family members or yourself who's been allergic to semaglutide, which would be hard to know, but technically if you're allergies to semaglutide, we would not prescribe that as well. Additionally, when you're on semaglutide, of course your calories are going to reduce, and patients always ask me, what diet and exercise regimen should I try? Well, it's very important to make sure to maintain protein consumption, because it is seen that there's a chance that you can have some muscle loss because you're not working out and you're not eating protein. So make sure to eat protein, and specifically weight training. Not cardio is great, but more like pushing and pulling of weights or push-ups to maintain muscle mass. Okay, what's most important here is what is the cost of this medication and of our program. So Elite Dermatology and the Oaks Plastic Surgery, we charge $250 to manage your weight loss program over the next 6 months. And you will pay that one time. That's for all your telemedicine visits. In person, we are located in Houston, managing the dosing and any nausea medications or any questions you may have over the next 6 months. You only pay $250 one time. Once you pay that money, we send in the prescription to the pharmacy that we use locally that you can pick up, and they can ship you the medication. The pharmacy will charge you, separate from us, a 3-month supply of semaglutide. And that 3-month supply will cost you $250. And they will explain to you on how they will deliver the medications to you, whether pick up or by mail, okay? How is that first 3 months dosed for you specifically? If you've never been on semaglutide before, the dosing starts at 0.25 for the first month, and it's a weekly injection. The second month is 0.5, and it's a weekly injection. And the third month is 1 milligram, and it's a weekly injection. And that will cost you, again, 3 months at a time, $250, and the pharmacy will go over how they will deliver those medications to you. In our program, what would be the next step? As you get close to that end of that 3-month cycle, you will contact us back, or our coordinators will reach out to you saying that you're running low. And you have 2 options at that point. If at 1 milligram you're feeling the effects of the medicine and you are losing weight, it would be in the best interest to maintain at 1 milligram so you don't have to increase your dose. And at the pharmacy, that will cost you $250 for approximately 2.5 months of supply of that medication at 1 milligram. If you feel like you want to be more aggressive, or you're just not losing as much as you're hoping, there are 2 additional doses that we can go up to by the manufacturer. We can go to 1.7 weekly injections for 1 month, followed by 2.4 weekly injections for 5 weeks, which gives you just over 2 months supply of the medication. But of course, the pharmacy is going to charge you a little bit more because it's more of the medication at $400. Okay? If you're a patient who is already on Ozempic, it doesn't matter the dose, you can still be a part of that program. And what we will do is we will tailor a program specifically for you. For example, if you are already on 0.5 or 1 milligram as a maintenance dose, when you call us, we will tell you the estimate of what the pharmacy will charge you to maintain at that dose. But that will be on an individual basis. Also, if you want any further information, read the text on this website. We will have the full risk and benefits of the medication. Of course, you can go to Ozempic at Wegovy.com for additional information, which is probably the most reliable source. And if you want a free consult with us, remember, just text the number here and we will set up a virtual telemedicine visit for you. Hope to hear from you soon, and welcome to our weight loss journey.